Welcome to part 4 of Mastering the CMS Team Initiative. In part 3, we focused on preparing clinical teams. We talked about the importance of role-specific education, workflow redesign, accountability systems, and collaboration both inside the hospital and beyond discharge. We also looked at examples of how education and accountability directly reduce complications and strengthen your outcomes. In part 4, we're going to shift our attention to the role of technology and training solutions. Remember, technology is not optional. It's going to be essential for meeting CMS requirements and making compliance sustainable for your hospital. For those of you joining me here for the first time, my name is Aisha Kulor, and I'm the Chief Clinical Officer for the Institute of Post-Acute UK. I bring with me more than 20 years of experience in nursing leadership, compliance, and post-acute care. I have served as a Chief Nursing Officer, Regional Director, Nurse Consultant, Legal Nurse Consultant, and I've also worked with hospitals across the country to improve compliance and patient outcomes. My passion is helping hospitals in the post-acute care space take complex CMS initiatives and turn them into practical systems that work. This part of the training is all about technology and training solutions. We'll discuss how digital platforms support compliance, how the Relias platform can be used to strengthen staff competency and education. I will also review a case study from ABC Hospital and talk about how to successfully integrate technology into clinical workflows. By the end of this session, you'll have a roadmap for using technology as a strategic tool in preparing for team. Here's our agenda for part 4. First, we will review the role of technology in supporting compliance. Second, we will discuss how digital platforms track staff competency, support performance monitoring, and standardize documentation. Third, we'll highlight the Relias platform and its features. And fourth, we'll look at a real-world case study from a hospital. Finally, we'll talk about how to integrate technology into your workflows step by step. Each of these areas connect directly to team readiness. Let's take a look at technology and training requirements. Technology is going to play a critical role in meeting team requirements efficiently as well as effectively. Automated systems will allow us to track staff training progress and document competency for regulatory compliance. Real-time dashboards are going to highlight key metrics and use predictive analytics to identify at-risk patients. Standardized templates and alerts will ensure we have a complete documentation as well as prevent gaps in care. And perhaps most importantly, technology is going to strengthen care coordination through secure handoffs, remote monitoring, and consistent communication across care settings. When these tools are built into your everyday workflow, compliance becomes reliable and consistent rather than reactive and fragmented. So, how are digital platforms going to support team compliance? As I mentioned previously, digital platforms are one of the most powerful tools hospitals can have to ensure compliance under team. So let's take a look at 4 specific areas where they make a difference. The first is staff competency tracking. Automated systems track staff training progress and knowledge retention in real time. Your learning paths can be tailored to specific roles such as the surgeons, nurses, and case managers so that education is both relevant as well as practical. And most important is competency education is stored and ready for surveyors, ensuring regulatory compliance is never in question. So instead of scrambling to pull training records during a survey, leaders can provide them instantly if they're using a compliance training platform. Second is performance analysis. Real-time dashboards give hospitals a snapshot of how they are performing on key metrics, such as infection prevention compliance, discharge documentation, or patient satisfaction. Predictive analytics also identify patients at risk for readmission, allowing staff to intervene before a problem occurs. Over time, your trend analysis highlights where the hospital is improving and where gaps still remain. So this turns compliance into a continuous improvement process and not just a one-time project. Third, your electronic health record integration is going to be essential because documentation is at the heart of compliance. Clinical decision support tools will guide your staff towards best practices, standardized templates to ensure every element is captured, automated alerts are flagged appropriately, and potential gaps are identified before the patient leaves the hospital. Let's take a look at an example. If a discharge education has not been documented, the system can prevent that discharge from being finalized until that step is complete. And finally is care coordination tools. These ensure the patient's journey continues smoothly after discharge. Digital handoff tools guarantee complete transfer of information to the next provider. Remote monitoring capabilities also allows the hospital to follow patients at home and help flag complications much earlier. And secure communication channels connects the hospitals, primary care, and post-acute care providers, reducing fragmentation and improving your outcomes. So together, these digital solutions don't just support compliance, but they make your compliance sustainable. They transform what could be manual, error-prone process into a reliable system that strengthens both outcomes and documentation. So let's take a look at the Relias platform. The Relias platform is one of the strongest platforms available. It provides a comprehensive education management system that allows hospitals to assign role-specific learning paths, automate training assignments, and track competency completion. The platform's content library include multiple courses on surgical best practices, wound care, documentation quality, and discharge planning. These modules are all evidence-based and designed to directly support the requirements of team. Relias also provides compliance reporting so leaders can demonstrate staff competencies to surveyors and regulators with confidence. In other words, Relias makes it possible to close the loop between education, practice, and compliance. Let's take a case study. Let's look at a case study for Hospital ABC. ABC Hospital was struggling with high surgical site infection rates and poor care transition documentation. These gaps put them at risk for significant penalties under team. So what did the hospital do? They implemented a comprehensive Relias training program for all the surgical nurses, focusing on wound care best practices as well as standardized documentation. They also developed templates for surgical documentation, and managers conducted weekly competency assessments. Performance dashboards were placed on nursing units to track progress. Within 6 months, surgical site infections dropped by 42%, documentation compliance improved by approximately 89%, and the hospital avoided an estimated $1.2 million in penalties. This is the kind of measurable improvement that becomes possible when technology and education are fully aligned. So let's talk about integrating technology with clinical workflows. So integrating technology into clinical workflows is not just about buying a platform. It's about making sure the system fits seamlessly into your daily practice. So here's a 5-step approach. Step 1 is your assessment. The first step is to evaluate your current workflow and identify where technology can close the gaps. For example, are discharge instructions consistently documented? Are follow-up calls tracked? Assessments allow you to see where manual processes are creating risk, so technology can be targeted where it adds the most value. The next thing you need to look at is configuration. Once the gaps are clear, platforms need to be customized to align with hospital protocols and CMS team requirements. That might mean creating templates in your EHR for surgical procedures, adding automated reminders for post-discharge calls, or building dashboards that track infection prevention compliance. So configuration ensures the technology isn't just generic, but rather tailored to the needs of your hospital. The third step is training. Even the best system will fail if staff don't understand how to utilize it. Training must be role-specific and practical. Surgeons may need quick reference guides for operative note templates, while nurses need hands-on training for discharge documentation modules. Case managers should be trained, for example, on tracking follow-ups and communicating with post-acute care partners. Training will build confidence and ensure easy adoption. Implementation. This is where you deploy solutions and requires more than just flipping a switch. Hospitals must provide support during go-live, troubleshoot very quickly, and monitor the usage to ensure adoption. This is the phase where we see the most resistance, and this is the phase where resistance can be the strongest. So leadership visibility and real-time coaching are going to be very critical at this stage. Final is your optimization. Integration is now one and done. Hospitals must continuously review performance and refine how technology is being used based on outcomes. If the data shows readmission remains high after a hernia repair, for example, the system may need new discharge prompts or improved follow-up alerts. Optimization ensures technology grows with the organization rather than becoming stale. So integration is a cycle. Assess, configure, train, implement, and optimize. When followed step by step, hospitals can embed technology into clinical workflows in a way that strengthens compliance, supports staff, as well as improve patient outcomes. To summarize part 4, we've seen why technology is essential for making compliance reliable under team. Digital platforms play a central role. They allow us to track staff competency, document compliance with accuracy, and improve care coordination instead of relying on paper or manual processes. Automation ensures that critical steps like our discharge education or post-acute care handoffs are never skipped. We also reviewed how Relias provides a powerful education management system. Relias equips staff with tailored training, competency tracking, and compliance reporting. This allows leaders to demonstrate with confidence that staff are prepared and that documentation aligns with CMS expectations. We looked at ABC Hospital, a case study where technology and Relias training together produced some measurable improvements. Infection rates fell, documentation accuracy increased, and the hospital avoided over $1 million in penalties. This is the power of combining training and technology in a structured way. And finally, we discussed integration requiring a 5-step approach: assessment, configuration, training, implementation, and optimization. When followed, this process ensures technology doesn't just sit on the shelf, it becomes embedded in your everyday practice. So the key takeaways is this: technology is not just a support tool, it's the backbone of sustainable compliance. Hospitals that leverage platforms like Relias and commit to structured integration will be the ones who not only meet CMS expectations, but also deliver safer, higher quality surgical care. As we close out part 4, let's take a look at what's coming next. In part 5, we'll bring everything together with a final readiness checklist that hospitals can use to evaluate their progress. This checklist will ensure nothing is overlooked as you prepare for 2026. We will also review departmental responsibility, and this will include surgical services, nursing, care management, quality, and IT. Each discipline has a unique role to play in meeting CMS expectations. And part 5 will make that clear with what's expected from each team. Finally, we will highlight external resources that the hospitals can access to strengthen readiness. So stay tuned and join me for part 5 as we close the loop on preparing for success under the CMS team initiative. You won't want to miss this.